Yeah, so as Lionel said, I was in a great research group, i.e. Lionel's, where I was doing my PhD. And it was really while I was starting my PhD that I started working on Sentimoto as well. And our objective in Sentimoto is a little bit outside of health, actually. It's really about taking the learnings and the approach of digital health and applying them to prevention and to social care, in fact. But the title of my presentation today is Mens sana in corpore sano. And this is a Latin phrase which has been used and abused ever since Juvenal first wrote it down. And it has been variously interpreted to mean either that a healthy mind can only inhabit a healthy body, or indeed that a healthy mind leads to a healthy body. And as we've seen from Martin's presentation, today both of these things ring true to us, especially as we're starting to unpick how the different threads of mental, social, and physical well-being actually affect our health. Yet, although our understanding of mental, social, and physical well-being is really broadening, we don't have the right tools to incorporate these into clinical standard care. Your GP, for example, is very likely to talk to you about your blood pressure, but is extremely unlikely to talk to you about how, or to quantify how sleep or social interactions or even physical activity is affecting your blood pressure. So today I will be looking at sort of a bigger picture context of well-being and how we're going about this, and how some companies, including my own, are trying to change the landscape. But I think to set the scene a little bit, I think one of the best ways of understanding the general picture in healthcare is one which I heard from Professor Muir Gray. And this is that we have already seen 2 revolutions in healthcare, and we're currently at the cusp of the 3rd. The first revolution was before we even understood the mechanics of disease, how it worked biologically and chemically. But we did understand how we could act to prevent the spreading of disease. So we've got the episodes of John Snow acting in London and Soho, identifying a particular pump as the root cause of a cholera epidemic, or even the work of Semmelweis, who figured out, surprise, surprise, that you just need to wash your hands in between seeing patients to reduce infections. And in fact, he reduced mortality rates by over 90%. And this first revolution started what you see over here, which is the average life expectancy for males and females. It started this exponential rise up to the second healthcare revolution, which was instead about understanding the underpinnings of disease and understanding how disease affects and influences our body. And this is something which started in the lab with Pasteur, but we still see today with advances in genetics and the kind of technology and discoveries that we really associate with medicine itself. And we thought that with this second revolution, we'd continue this upward trajectory and potentially keep on living forever. We'd find a miracle pill for any kind of disease that we might think of. In fact, as we know, it's a little bit different. And in the last couple of decades, we've seen life expectancies starting to taper off. And more preoccupyingly, we see healthy life expectancies in many regions across developed countries, in fact, starting to decrease. And we've talked about this a lot, but the key causes behind this are really non-communicable diseases, the likes of chronic diseases or cancer, where if there's one thing which is in common to all of them, it's the fact that the patient really needs to engage with the disease to delay it or even to prevent it. And this is really what constitutes the 3rd revolution in healthcare. It's the idea that the patient needs to be engaged, that the patient needs to start using their own lifestyle and their own behavior to change the course of the disease. And in a way, it's a bit similar to the first healthcare revolution in that although lots of very clever people are working on this, we don't have an exact understanding of how our behavior is influencing the course of disease, and vice versa, how the course of the disease is influencing our behavior. But what we do have instead is an understanding of how we can act to prevent. And the evidence is really clear. I mean, I don't think physical inactivity or even smoking need any kind of introduction, but even fuzzier concepts like social connectedness and mental well-being are really starting to gain in evidence. I don't know if many of you have seen the headline, sort of social isolation kills as much as 15 cigarettes a day. That's a bit tragic, but it's really reinforcing this concept that these behaviors, these forms of well-being are extremely important. And in a way, it's almost trivial. It's sort of 40 years since Jane Fonda first released her first dance video, and that really cemented our cultural obsession with fitness. But it's a really profound change in tack. It's going from seeking an external miracle pill as the cure to looking to ourselves to solve problems. But we need a completely different tool set if we want to approach behavior from a healthcare or even social care point of view. Healthcare has to go outside of its traditional domain of hospital or even seeing people as patients and start working within healthcare, within social care to help the people live longer and healthier lives. And the real change that we've had from the sort of questionnaires which look at loneliness or physical inactivity or even mental well-being to something which is a little more automatic came first with smartphones, but then with the quantified self movement that really popularized all the various wearables that Lionel was showing earlier on. And it's companies like Fitbit and Vitality that are really changing the mold and really, in fact, breaking the mold here by creating new business models which are centered around health and centered around insurance and are creating the evidence base which is necessary to bring these concepts of fitness and well-being into the employee's health. But if there's one thing that all of the various wearables that Lionel was showing, or even all of the fitness applications that we see today, one thing that they have in common is that they're all targeted to a young demographic, a demographic of people generally in employment and generally between 20 and 50 years of age. And this completely obviates any kind of advantage that these technologies might confer to the people who may need them the most. And this is where my company comes in. From the very get-go, we started working with older adults to develop technologies for people who are aged between 50 and about 80. And paradoxically, we made a strategic decision from the very beginning to use smartphones and wearables as our means of working with them. I say paradoxically because when I first started my PhD in 2011, less than 5% of older adults in the UK actually owned a smartphone. And people kept telling me, oh, look, my mother doesn't have a smartphone, my grandfather doesn't have a smartphone. There's no way they'll ever get one. There's no way they'll ever learn how to use this. Luckily for me and my company, this has changed significantly in the last 5 to 6 years, and we now see over 40% of older adults using a smartphone day in and day out. And this is not just because of older people of the baby boomer generation entering into retirement age, but it's also due to the fact that if your Nokia 330 finally dies, you're really hard-pressed to find anything to replace it which is not a smartphone. Another reason people said we were a bit crazy to go into the social care and elder care space was they said, well, actually older people do have their own set of devices, and we could even consider them healthcare devices, wearable devices, and they look a little bit like this. But to me, these devices are inherently tied to extremely frail people. And as a result, this is a self-reinforcing kind of action, which means that no one who's extremely frail wants to use this device, which they see as stigmatizing. And so it completely obviates any kind of preventative action they might have. What's more, it doesn't communicate with the user. On the other hand, with digital tools, we really have something which we can use not only to start quantifying the effects of well-being, but we can also start communicating with the users themselves. When we first started Sentimoto, we actually started creating our own wearable device, and in the very early days, it looked something like this. But despite winning the London Wearable Tech Show sort of startup award, when Apple Watch came out, we were like, okay, there's no point in us starting to compete against people like these, people like Apple, people like Samsung, when they're creating a huge plethora of devices which can measure pretty much anything you want. Instead, what we started concentrating on is creating a software-only solution, an app, which can start taking in and harmonizing all the various data streams that you have from the huge wide array of sensors which are available on the even wider array of smartphones that we have today. And we started testing this. So in a joint study with Bupa, we started looking at just how well our passive sensing on our phones could compare to standard well-being questionnaires. We looked at things like loneliness, we looked at things like mental well-being, physical activity, etc. And what we found was really quite extraordinary in the sense that we could find correlations of about 80% just using simple things like the GPS, the microphone, and the accelerometer, which are easily accessible from any kind of smartphone. Of course, these are really early day pilot study kind of results, but they say that we can start hoping to accurately measure and tell when someone's becoming socially isolated, when they're becoming physically inactive, or even when their mental well-being is changing significantly. And being able to tell early, or even just at the point, is extremely important because it can prevent the downward spiral of health. So we're starting to work to commercialize this product with partners at local authorities and public health across the country so that we can actually bring this application into the hands of the users. And crucially, and this is the part I like the most about the application, we don't just measure the kind of aspects of well-being and sort of make an assessment on that or just show it to the users in the same way that Fitbit does. What we do is instead we do all of that, but we also take that information and match it to the databases of activities that are provided by local authorities or by charities or even by private providers to make sure that we can match the right user to the right activity to help them stay as healthy as possible. It's a kind of automated social prescribing, if you like. These are extremely early days. Our end goal is not only to remain within the area of social care, but to start looking at how we can quantify the effect of wellness on specific disorders associated with aging. And we've received interest from departments from cardiology to oncology to help incorporate this kind of data into clinical trials so that it can eventually be used in standard clinical care. Yeah, so if you're interested in speaking to us from a sort of research angle, or if you're interested in speaking to us from a commercial avenue, I'd be delighted to speak to you. Thank you very much.